This is percussion therapy. This is used to help relax some of the muscles and some ligaments on the inside of the outside of the curve. We have many different speeds and we do many different areas of the body. But for scoliosis, we're really looking at just the curve initially. And the idea would be is that we want to do the outside of the curve and the inside of the curve at different speeds. And this is a thoracic scoliosis. So we would do the outside of the curve and then we would do the inside of the curve. The outside of the curve, we typically use a higher speed. And then on the inside of the curve, we tend to use a lower speed. So again, we'll use the high speed on here, and then we'll use the lower speed on the inside. Let me go ahead and kind of show you where that's done. So this is the lower speed. And you see it's providing a very low vibration to this area. This is mostly working with the ligaments in that area. And when we go to the high speed, we're working mostly the muscles. So going to high speed, and this is working more the muscles. And we're stopping at each segment within the curve and trying to focus mostly on the apex of the curvature in each of these areas. This is percussion therapy, but this is more for an S curve. With an S curve, we're going to be using high speed on the outside of the thoracic curve and outside of the lumbar curve, and we're using low speed on the inside of the thoracic curve and the inside of the lumbar curve. And again, the same type of motion. We're focusing on each segment as we go through. This would be the high speed setup, and of course, going through the lumbar curve, and then the low speed setup will be going through the inside of the curve in each area. And that's what makes us work on these areas differently based upon the curve type. This is the high speed setup. This is the low speed setup. This is another form of percussion therapy that we use. This is, we call this very high speed. And you can hear the frequency of this when I turn it on. It's very, very high speed. I'm going to turn it off, obviously you can hear me. And we use the very, very high speed on the outside of the curve on both areas of the curve. So with the thoracic curve, we'll just do the thoracic spine. This being an S curve, we'll do both areas. This is percussion therapy on a lumbar curve. You can see a lumbar curve, we're mostly focusing on high speed only on the outside of the lumbar curve, low speed in. A lot of times in lumbar curves, we also have to work on the pelvis and the glutes and the hamstrings. We typically do those on most patients as well, but specifically on the lumbar curve, depending on what we find needs more relaxation, depending on what needs more tightening. So let me show you, demonstrate the percussion therapy on a typical lumbar curve, right? We use the low speed on the inside of the curve. Then we'll use the high speed on the outside of the curve. That's how we would do percussion therapy on a lumbar curve.